Your moves look great, Megan. Well, we're going to transition because over time we look in the mirror and we see a wrinkle here and a wrinkle there, or we notice some thinning in our hair. But there are ways that you can roll back the clock to give yourself a more youthful and fresh look. And here to explain is Dr. Nicole Hayre of the Cosmetic Dermatology Center in McLean. And later we're going to tell you about a special offer for all of our Great Day viewers. So make sure you stay tuned in for that. But first, welcome Dr. Hayre to Great Day.
Thank you for having me.
Now tell us about a really popular procedure for treating wrinkles.
Well, one of my favorite ways to treat wrinkles is Botox. And in fact, it's the #1 non-surgical procedure in the country, and it has been for many, many years, so it's extremely popular. But what a lot of people don't know is how safe it is. And Allergan, the maker of Botox, has studied it extensively, and in fact, they've enrolled 11,000 patients and studied, and it's safe. It's reliable, predictable, so people shouldn't hesitate to give it a try.
And you can use it in different areas of your face. Most people think of forehead, but it can go pretty much anywhere. Tell me about that.
Yes, so there are several areas that are FDA approved, and one is between the eyebrows, so right in here, and the other is around the eyes, or the crow's feet area that we like to say. But advanced injectors will use it off-label in other areas of the face or neck.
That is great. And you brought some before and after pictures just to show us all how effective this procedure is. Tell us about that.
Yes, so this is a great example of a before and after with Botox, but this is also an example of combination therapy where we used some fillers, and you can see I've reduced the look of puffiness under her eyes just using some filler. And it gives a very natural look. She doesn't look as tired, and that would usually last about a year.
Lasts about a year.
Mm-hmm.
That is great. So this is not something where you have to keep coming back and get it over and over again. You get it and then you're good for 2017.
Yeah, exactly. Now the Botox you would have to repeat more frequently, and this is a great example. So this lady, she comes in 3 times a year for Botox, and you don't really see much difference between the two photos, and that's actually the point of these photos because there's a 12-year span between those photos.
12 years later.
Yes, 12
wow.
years. So this is an example of how Botox can actually have a preservative effect.
Okay, I just want to make this clear to the viewers here. This is this woman 12 years earlier.
Yes.
And she looks the same.
Yes.
And that's because of Botox.
Botox.
Okay,
correct.
that is amazing.
Yes, it is.
Now, something I've experienced, I don't know about you guys at home, is, oh my goodness, as you get a little older, your hair is not as thick and youthful and full as it used to be. And I'm like, what can I do? What can I do? Help, Dr. Hayre.
So this is a, we just talked about a nice long-standing procedure. This is a very new procedure. It's very exciting. It's a natural way to use your own blood product to rejuvenate the hair.
Okay, and that's what the procedure is going down there. So tell me more about this.
So what we do is we use PRP, and that stands for platelet-rich plasma. Some people might have heard of this before because it's being used in orthopedics to rejuvenate cartilage. But now we're using it for skin rejuvenation and hair rejuvenation. And there you can see when we spin the blood, it separates into layers. We take out the PRP, which has a lot of growth factors in it, and we inject it back into the scalp.
Okay, so I just want to reiterate for viewers at home, this is something where it's using your own body genetics to help you grow more hair.
Correct.
Interesting. Correct. And you have some before and after pictures for this one as well, right?
We do.
Okay, let's take a look.
So this is a patient after 2 treatments, and most people do 4 treatments. The protocol has been 1 treatment per month for 4 treatments. Now this is not an FDA approved treatment yet, and most people who are doing this are treating monthly, but I think more studies will come out in the future. And you can see he already has some nice thickening of the hair, more coverage on top. And here's a lady who had extreme thinning, and she did PRP treatments and was absolutely thrilled.
Wow, because I know we saw the man in the video, but I just wanted to say women can go in and get this as well.
Yes, yes, and it's a very easy treatment to do. It's natural, and as you pointed out earlier, a lot of people suffer from this. It's very common.
Yeah, and I'm thinking too, it's a lot easier to rock the bald look if you're a man, but if you're a woman, it's like, help.
Yes, this was, you can imagine this was very upsetting for her to be losing her hair to that extent, and she was at the point where she might need to wear wigs and came in for treatment, and she did great.
And this is now coming out of her own head?
That's her hair.
It's thick. Okay. Wow. Okay. Well, I'm going to tell the viewers at home.